All of these changes are caused by hormone changes. If you want to learn more about natural hospital birth, subscribe now. Hi, and welcome to the free COPA Birth Early Pregnancy Series. In this video, we'll be discussing the top signs of pregnancy and why they happen. My name is Katie Griffin. I'm a registered nurse, Lamaze certified childbirth educator, and the lead educator for COPA Birth. I'm also the mother of 6 and almost 7. As I just mentioned, today we're going to discuss the most common early signs of pregnancy and why they happen. We'll cover implantation, missed period, breast changes, nausea, and fatigue. Since you're watching this, there's a good chance that you think you might be pregnant. If so, congratulations! The waiting and wondering can be torture, but for the most part, we're oblivious to the changes going on inside our bodies during these early weeks of the pregnancy. But you may notice implantation. This is the process in which your little embryo burrows safe and snug into the nourishing uterine wall. It occurs about 7 days after fertilization. Some moms, but certainly not all, notice mild cramping sensations, which may or may not be accompanied by implantation bleeding. As the embryo implants in the wall of the uterus, the tiny blood vessels in the uterine lining can get disrupted. A very small amount of light bleeding can occur as a result. We're talking a few spots of blood. I want to assure you that this is both normal and harmless. It differs from a menstrual period because it won't get heavier and dark in color like a typical period. You certainly won't have to change out pads or tampons. For about 30% of women, their first symptom of pregnancy will be a missed period. After the embryo implants, the body begins to produce a hormone called human chorionic gonadotrophic hormone, or HCG. This hormone signals your ovaries to stop releasing eggs. At the same time, it tells your body to make more estrogen and make more progesterone. The increase in these hormones stops your period and starts the growth of the placenta. Almost 20% of women report that breast changes were their first sign of pregnancy. You may feel breast tenderness, fullness, or tingling in the nipple area. Some women notice a darkened areola, which is the area around the nipple. All of these changes are caused by hormone changes. Nausea is a very well-known sign of pregnancy. For just over 30% of women, nausea sets in by week 4, which is right around the time you miss your period. For some women, it comes later. Still, 94% of us will experience nausea by at least week 8 in our pregnancy. Like most signs of pregnancy, nausea is caused by changing hormones. Along with the nausea, you may have vomiting, food aversions, or food cravings. Fatigue is a common symptom of pregnancy. You may feel sleepy or worn down, or it may be an exhaustion unlike anything you've felt before. Even though you can't see anything happening yet, your body is using a lot of energy to grow your teeny tiny baby. Some other things causing your fatigue may be high levels of progesterone, lower blood sugar, lower blood pressure, and a boost in blood production. But ultimately, ladies, the only way to know for sure that you're pregnant is to get a positive pregnancy test, whether urine or blood. Earlier, we talked about HCG, the hormone produced by the placenta after implantation. This is the hormone that pregnancy tests measure, and it takes a little while for there to be enough in your blood or urine that it can be detected. This is why most pregnancy tests can't detect a pregnancy much earlier than the first day of your missed period, otherwise known as week 4 of your pregnancy. If you've tested much earlier than this date, don't be disappointed or assume you're not pregnant if you're not getting positive results. It may just be too early to tell. As a side note, the cheap dollar store pregnancy test won't cut it if you haven't missed your period yet. I can tell you from experience that they're simply not sensitive enough to detect low amounts of HCG. You'll have to go for the more expensive tests. If your period is more than a week late and home tests are still showing negative, you can call your healthcare provider and ask about getting a blood test. Blood tests are more sensitive than the urine tests you can buy over the counter and may be able to give you an answer. And if not, chat with your provider about your missed period and non-pregnancy related causes. With this pregnancy, the very first thing I noticed was an increased gag reflex, which didn't make it to this list but is common during pregnancy. So what was your first sign of pregnancy? Let's hear it. Share it in the comments below. If you found this video to be helpful, Click the link below now to enroll in the free early pregnancy course. We'll guide you from weeks 4 to 24 of your pregnancy. You'll receive answers to the most common questions women have about the baby, physical and emotional changes, medical conditions, and much more. Click the link below now to enroll in the free early pregnancy course.